Sorry for the troubles, but I thank you for the organizers and to invite me to present our personalized approach for the medical liver biopsy, which is extremely important for the pharmaceutics and drug delivery systems, because as my colleagues previously described, the liver is a key organ in the processing of drugs. We are going to look at substantially the liver biopsy, how important it is in childhood and youth, the grossing, how we practically handle with the biopsy in our hospital, and also the molecular genomics and perspectives. Receiving royalties from Springer, Elsevier, and our publisher, but are donated to kids and family charities, don't have any conflicts of interest. The next slides, please. Sorry, you can go ahead with the next one. Perfect. There is a substantially one alarming trend in the Western countries, and obviously in Canada and United States, mostly on the top of the list, and with a childhood overweight and obesity. Obesity rates extremely high, and obviously the situation is a little different from province to province, and also in the states from state to state. Next one, please. In this, you can see how the increasing of the trend, if you compare with the previous decades, there's been an increase of the prevalence of obesity and overweight in childhood, defined with an age below 18. But we know that that the obesity does not affect exclusively the children, but also young adults. The next slide, please. You show them that substantially how extremely dark are the provinces which evidence the increased trend of overweight, and the factors behind that. It's only for some reason understandable, because some of the provinces with the highest rate of obesity are substantially exposed to colder temperature than others, and there is limited activity outside, and obviously this an important aspect, but also hydrocarbonated beverages with sugar and refined sugar are also an important aspect. But next slide, please. The liver biopsy, both and I supervise also the some animal studies for some different companies and also the different institutions. But liver biopsy is critical in humans and continue to play a paramount role in clinical practice. And we indicate the surgical when or non-targeted as a medical and surgical to allow assessment of the liver in general. The advent of the non-invasive tools, and we have a new serum biomarkers, and obviously the new technology applied in elastography, given also to physicians more tools to estimate the severity of fibrosis. However, liver biopsy remains in mostly of the pediatric societies and also adult societies the gold standard test to give satisfactory to give a satisfactory result and estimate the fatty change in the liver. The medical liver biopsy substantially to aims to establish the diagnosis and also to assess the severity of grading and staging of the disease underlying the troubles the patient has. Next one, please. The new classification changed recently from the consideration of NAFLD to MASLD, with the new definition of metabolic associated metabolic dysfunction associated steatotic liver disease. Steatotic term substitutes the term of fatty liver, and then a MASH practically taken the place of NASH. The MASH activity frequently connected to you can connect with different scores, and there are a few publications on this aspect from our group. But one of the most frequent scores that we applied is the clinical research network system, which involves three substantially parameters: the fatty change, the lobulitis, and hepatocyte ballooning. The fatty liver change is critical, and according to the portions of the fatty liver, you can have an increased rate on increased score, and similarly for infiltration of the hepatic tubercles by inflammatory cells, you can find also an increased score, and the ballooning is the third parameter which is contemplated in the CRN system. Next slide, please. We carried out a systematic review using PRISMA, involving literature research of academic databases and targeting specifically the handling of both liver biopsy with both terminologies, also the new terminology MAFLD and the old terminology NAFLD. Data were extracted and used to determine the current protocol in our hospital. Next slide, please. And you can see substantially in a QI system in a lab, we used to differentiate the phase with a pre-analytical phase, analytical phase, and post-analytical phase. And in the pre-analytical phase, it's critical that, to assess the collection, identification of the patient, or the animal that you work on, experimental animal you work on, the fixation, the pathology requisition form, filling correctly. We used an EPIC system as electronic medical record, and transferred to the pathology lab. In the analytical phase, we have the reception, registration, and obviously the grossing of the tissue, processing, the paraffin embedding, microtomy, and then obviously liver panel staining that we used, and the evaluation on ultrastructure using our Philips electron microscope, and the staining for the intrahepatic biliary epithelial cells. There is also post-analytical phase when we digitalize the slides and review the slides, and we report our report exclusively electronic with faxing, almost very rarely used, only for hospitals not linked to our central network filing, and the multidisciplinary team meetings for discussion of the cases. Next slide, please. In this iconographic cartoon, you can see we divide the core. We have more than obviously than one core, and usually we request 2 to 3 cores for patient from experimental animal. We we use the one portion, 1 millimeter for the EM sample, one for the assessment using an oil red O staining, capturing the fatty cell change, and then we have the sample which will be processed for formalin fixation and paraffin embedding, and then the optional EM sample in case we we have a second core. The next slide, please. In this slide, you can see, you can identify correctly on the upper left. You can see one liver stained with oil red O staining, which disclose exclusively very very few vacuoles, and the status is relatively mild. In comparison on the upper right corner, you can see the liver is almost infiltrated exclusively by fatty cell change on 70 to 80% of the liver tubercles, and in the lower lower left, you can see a focus of lobulitis, and the lower right, you can see the fibrosis with an expansion of the portal tract, and which shows the bluish staining, also present around some liver cells surrounding the portal tract. The next one, please. The studies show the ability to detect the muffled metabolic associated steatotic liver disease in liver biopsies with accuracy. We reached the 100% implementing the oil red O staining and preserving the rest of the frozen tissue for studies involving SNPs and also currently also plant epigenomics studies. And the current protocol of liver biopsy is supported by strong pre-analytical, analytical, and post-analytical handling steps. Genetic association investigation have identified some specific SNPs that are probably highly implicated in the progression of muscle toward neoplastic change, also a hepatocellular carcinoma. Next one, please. The study that we practically looking at have identified different genes that are patatin-like and MBO 87 STAT3 that affect the occurrence of and relapse of fatty cell change in the liver, but also seem to be significantly associated with muscle susceptibility. This is at the moment currently under investigation, and because the Canadian population is also heterogeneous, we are trying to discern the different SNPs in different cohorts of patients. In MASH, or metabolic associated steatohepatitis, also the presence of inflammation, we found that MIR as a microRNA 122 was reported as upregulated and suggested a potential prognostic marker. Next slide, please. The next slide, please. Yes, a genetic risk factor comprising 3 common variants in the gene, PNPL, azopatatin, TMX6, and hepatocyte steroidehydrogenase, was associated with up to 12 times higher risk of liver cirrhosis and up to 29-fold higher risk of liver cancer. And now you can understand how these 3, obviously, these genetic risk factors, the risk score, can influence these people. And can you go back on the results 3, please? Should be the slide 14. Yes, thank you. And on F5, please. And we found that substantially this is very important, specifically when you handle with the patient and you want to indicate their risk to develop liver cirrhosis or have a high risk of liver cancer. We are also planning also some epigenomics and also methylation of some in some genes in our liver biopsy studies. Large scale methylome profiling may be also overwhelming at the moment, but we are contemplating using also cooperation with several centers. Next one, please. There is the current methodology. You go on what we are substantially is a gene expression profiling with RNA. The direct gene expression levels, we have a high level of reproducibility, probably because we have a rush processing and also rush handling after the liver cores are delivered, are practically taken out from the patient and sent directly to the pathology department, and also this new classification applies quite good in our system, and we are planning also to implement some machine learning aspect for the some steps of analytical phase. I would like to go on the next one, please. Next slide. May you have this next slide, please? Yes. In conclusion, liver biopsy both for the patient, the overwhelming obesity and overweight in Western countries is critical, and the thorough examination of the liver biopsy is important for the management of these patients with this disease. A clinical application of gene expression or methylome profiling, and so currently we are concentrating on high demand of the gene expression may be relevant for prognostic and predictive scope for the clinical trials. And we recently published how the artificial intelligence can be applied in contemporary clinical trials with public health Harvard Medical School. And in our current endeavors, we are implementing also AI tools, as indicated, to nucleate future prognostic biomarkers in pediatric muscle. And obviously, we will update on this issue. And next one is just a slide indicating the if you can go on the next one, please. Next slide. Yes, it's substantially a comprehensive book of childhood and adolescent diseases, and you're welcome to from Springer, and you can probably have an opportunity to see also our chapter for non-alcoholic steatohepatitis. And next one. The next slide practically show our acknowledgement of my group, and also my mentor, and in Innsbruck, Austria, and also the large research group in Alberta and in Ottawa, and cooperation with several institutions. And I'm happy to take any questions. Thank you very much for your attention.